Good morning, good afternoon, and perhaps good evening, colleagues, and thank you for joining us today for this event, a webinar on the OpenLMIS. This is a webinar jointly organized by ICTD Digital Center of Excellence, Digital Health Center of Excellence, and regional offices for East Asia, Pacific, and South Asia. OpenLMIS is an open source electronic logistics management system. And basically, it was created in 2011 basically to replace paper-based systems, as well as automate logistics processing for over 11,000 health facilities in Africa. It currently is used to manage data and logistics for major health programs, including vaccines and HIV/AIDS. Now, this particular event is a series of events on deep dives on logistics management information systems, basically that were endorsed by GAVI. Just by the way of introduction, the ICTD Digital Center of Excellence basically has been launched in April this year to provide coordinated technical assistance to national governments and partners on digital solutions to address health and information system priorities in the context of digital public goods, as well as deployment of technology and acceleration of proven technology solutions and approaches. The Digital Health Center of Excellence provides coordinated technical assistance to national governments and partners on digital solutions looking at health and information system priorities, specifically in the context of COVID-19 pandemic, as well as looking at the post-COVID pandemic health system needs. Now, I would like to give a warm welcome to our speakers today. First of all, Mr. Brian Tellisin. Brian presently serves as the Director of OpenLMIS, as well as the PATH, Global Human-Centered Design and Data for Action Practices. Mr. Tellisin helped to shape the PATH approach to business systems analysis that catalyzed early versions of OpenLMIS and associated adaptations for immunization information systems. He has served on and worked with various global standards organizations, including GS1 and OpenHIE. Mr. Tellisin holds a Master's of Science in Health Informatics and has over 30 years of experience in systems analysis and re-engineering, application development and implementation, including projects with organizations such as World Health Organization, UNICEF, GAVI, USAID, Bill and Melinda Gates Foundation, as well as other non-government organizations and multinational firms. He currently lives in Nairobi in Kenya. The other speaker that we'll hear from today is Mr. Wesley Brown. And Wesley is the Technical Product Manager on the OpenLMIS and the Senior Technical Manager with Village Reach. His background is in designing and building software solutions and managing software development teams. Most recently working on the healthcare IT space on healthcare systems and institutions in low resource settings. And he has been doing it for the past 9 years. He also resides with his family in Nairobi. He will be joined also by the two colleagues of theirs, Mr. Pranil Singh and Mr. Dean Tabbert. I also would like to extend a very warm welcome to my UNICEF colleague, Benjamin Grab, who is the EAPRO Business Technology for Development focal point, and who has been very instrumental in organizing this particular webinar series. So far as the logistics is concerned, we're going to hear first from Wes and Brian, and then we're going to have a Q&A session. You are most welcome to basically raise your questions using the Q&A facility. Please do not use the chat, please use the Q&A, and we will be aiming to answer as many questions as we have during the allocated time. You will be able to vote on the questions that you feel relevant to you, and there will be obviously the questions with the more votes will be obviously taken to the top of the list. And the recording as well as the presentation from this session will be made available to you as well. So once again, I'd like to extend a very warm welcome to all of you joining us today. Without much further ado, I'm going to pass over to Wes, who effectively provides his or shared his presentation. Over to you, Wes. Thank you.
Thanks so much, Wojciech. And thank you everybody for joining today. Thank you for the opportunity to be able to share just a little bit about OpenLMIS and be able to at least give hopefully a brief overview of what the system is, what it does, and hopefully pique your interest. OpenLMIS is a logistics management system designed to support countries and help streamline their supply chain operations. This software has been vetted and pre-approved by global actors like GAVI and UNICEF, and was recently signed a long-term agreement with the UNDP. Next slide, please. So as Wojciech mentioned, the two presenters here, myself, Wesley Brown, I'm the OpenLMIS product manager, and then Brian Taliesin is the OpenLMIS director. And we just both happen to be located in Nairobi, Kenya. So it's nice to be able to join you from there today, where it's still a little bit chilly, I have to say. Yes, so on to OpenLMIS. So for those of you that aren't familiar with OpenLMIS, the main features are what we see here on the left. The items related to requisitioning, so the requesting of new stocks, order fulfillment, and stock and inventory management. That's really the heart of OpenLMIS. The LMIS stands for Logistics Management Information System. So that's really what the focus of OpenLMIS is managing the logistics. So the stock and inventory management are somewhat self-explanatory, but being able to keep track of what you have on hand at an individual facility, but also be able to aggregate that data to be able to see for a region or a district and be able to make hopefully intelligent decisions based on the information that you have. That information then flows into a requisitioning process, which can either be a push or a pull, meaning the facilities themselves can either be requesting new commodities or new vaccines, whatever it may be, on a periodic basis, or more likely in a vaccine scenario, they would be the information would be pushed to those facilities from district warehouses or other central locations that have more of a global perspective on what's available and what's needed. And then the last piece of that is the order fulfillment. So once those requests have been approved and are being shipped out, then the facilities need to know what they should be expecting and be able to say that, yes, I received what I was expecting to receive, those kind of operations. So then the features there on the right are supporting those core features. So analytics and reporting, obviously, this is kind of like what I consider like the carrot, in terms of like, this is the reward for having entered all this data into the system and being able to keep track of it, is that you can now be able to use our analytics and reporting features to come up with really easy ways to try and track what kind of information you need to know. Being able to see, key KPIs, being able to identify areas of focus that you might want to put more attention to. Mobile integration, we currently have an integration with another open source system called OpenSRP, and we're right now working on a OpenLMIS mobile application to help with stock management. And then lastly, I'm including the cold chain equipment as a major feature for this time period because of the focus on vaccines, specifically the COVID vaccine, and then the cold chain becomes vitally important in that area. And we have an integration that I'll get into it a little bit later, which allows for real-time alerts and being able to actually monitor the equipment all the way down to a facility to be able to make sure that the deliveries are going to be able to be kept at the right temperature. Next slide, please. So the open part of OpenLMIS refers to the fact that we are an open source project. And the guiding principles behind that is really, it's really focused on this initial piece of the shared investment, shared benefit model, where we have many different individual contributors who are able to each be able to benefit from the work that others are doing. So we have many different partners that are part of the OpenLMIS community. And when we are doing work for specific implementation or work that one partner sees as being needed that maybe another partner hasn't seen yet, the way that the software is designed allows us to be able to incorporate that work in such a way that others can benefit from it. That this also then flows into how we interoperate with other systems. OpenLMIS tends to be one part of an e-health architecture for a country or even a big organization. And so OpenLMIS tries to fit in well within that e-health architecture. So being able to consume data from appropriate systems and be able to distribute data back to other systems as needed. And the way that we do that is not by building one-off solutions, but by utilizing standards and being able to utilize robust APIs for that kind of interoperability. And then lastly, when it comes to actually being able to change the system, when, as implementations are done, when a country decides to use OpenLMIS, almost always there's some kind of changes that are needed over time. The software has been designed to be able to be configurable and extensible, meaning that you can configure the system in many different ways, which I'll get into in a minute. But you can also extend the system so that you can make it do totally customizable things. But you can do so in a way that allows you to continue to receive updates from the core system, from the global team that is building OpenLMIS, so that you're always making sure you're getting the latest security updates, the latest performance improvements, things like that. Next slide, please. So on to configurability. OpenLMIS is extremely configurable. It's intended to be able to be used in a wide range of scenarios and be able to have one core system that can be used for many different country-specific implementations. So here's some of the examples of the things that you can configure. So you can have one program, for example, like a COVID vaccine program, or you can have many programs all running within the same system, and that can change over time. So you could start off with just having a basic system up and running for one program, and then over time slowly include more programs, include more levels within your geographical hierarchy, add more places within your country, so more locations. You could start off within, like a pilot area to be able to kind of test out how is this going to work, and then as you evaluate that and hopefully decide to grow into more parts of your country, then you can continue to add more pieces, and the system will allow you to do that live. You don't have to redeploy a whole new system. You just have to continue to adapt the existing system as it is. So OpenLMIS is intended from the very initial design to be extremely configurable, and that allows a lot of power. One of the things you'll hear us talking about here in a little bit is a specific version of OpenLMIS that we have created for COVID to be able to manage PPE, vaccines. But it's important to note that that is just a normal instance of OpenLMIS that we have pre-configured for that specific scenario. And that allows us to be able to take that, and you can get it up and running very quickly, and then over time add to it. And it's still just a normal version of OpenLMIS. There's nothing super custom, and this isn't some kind of stripped down version of OpenLMIS. It's the real thing, just configured for a specific scenario. Next slide, please. So two of the other functionalities that I wanted to mention here are the offline support, and then our integration with the remote temperature monitoring piece that I mentioned earlier. So OpenLMIS has what we call intermittent offline support. So OpenLMIS runs in a web browser. It's a web app, but the way that it's been designed, it's actually a web app that I'm going to say doesn't require the web. So once you get logged in, you're able to continue using the application, even if your internet connection goes down. So you can be able to record stock operations, be able to do stock takes, be able to even make requisitions if you're doing a pull system. And that can all happen offline. And then once you get back online, once your system reconnects, then that information will automatically synchronize. Also related to that is the mobile app that I was mentioning a little bit earlier that we're working on right now that will also allow for that same kind of offline functionality. So OpenLMIS recognizes that, we recognize as OpenLMIS, I should say, that there are many scenarios, many places where OpenLMIS is being used where a connection is just not very good, not reliable. And so it's designed to be able to work in those scenarios. And then on the remote temperature monitoring piece, where we're working with a solution called NextLeaf. This is just one of the potential providers that we work with who can give us temperature alerts and notifications about cold chain equipment in real time. So that information flows directly to OpenLMIS. If there's other temperature monitoring providers that you are utilizing, that's certainly something that we would love to talk to you about and see if there's ways that we can integrate those kind of solutions as well. Next slide, please. So continuing on the interoperability piece, as I mentioned earlier, OpenLMIS tends to fit into an existing e-health architecture. It's not one system that kind of operates on its own. It tends to fit into a number of other health-related systems. Some of the big ones include systems like DHIS2, which is a health management information system, or warehouse management systems like Epicor, or an ERP, same kind of thing, medical record systems, facility or product registries, and then being able to connect to other kind of mobile data or other kind of external tools. And so OpenLMIS, we have existing connections with all of these kind of systems. For example, for DHIS2, we have an integration in Malawi and in Mozambique, and our implementations there. We're working on one in Angola. On the warehouse management systems, we have work going on in Malawi for that. We have integrations with OpenSRP that I mentioned, and OpenMRS that have been tested and piloted. And then we have existing many different kinds of connections to facility registries and product registries that are in operation. The important thing to note here is that the way that OpenLMIS tends to work through these integrations is through standards. For example, with DHIS2, we would be working with the very well-known standard of HL7 Fire. For more ERP, product-related information, it would be GS1. To connect to facility registries, product registries, we would be working through something like an OpenHIM or OpenHIE, some kind of health information exchange, so that OpenLMIS fits within the e-health architecture that exists and doesn't kind of exist all on its own on the side. Next slide, please. So I mentioned this a couple of times. So one of the things we're really excited to be able to share with you today is what we're calling the OpenLMIS COVID edition. And this is a new simplified configuration of OpenLMIS that allows you to get up and running with OpenLMIS very, very quickly with a version that's specifically tailored to be able to help manage things like PPE and vaccines and the assorted other commodities that are needed to manage those. It's something that we've worked hard to make it just as simple as possible to get it up and running, so that you can get up and running quickly, because we know that time is of the essence when it comes to COVID-related tracking. As I mentioned before, it's basically the same OpenLMIS as any other version of OpenLMIS. It's just a streamlined configuration of it. But because it's the same version of OpenLMIS, you get the same stock management, equipment tracking, report dashboards, proof of delivery. And you can enable things like the cold chain equipment that I mentioned before whenever it is appropriate to do so. Our general approach with this version is to say, let's just get up and running with the smallest set of features enabled as you need, so that you can get up and running quickly, and then we can add to that over time. So the idea is here to kind of grow from what we're going to think of as like an emergency process of, we need to get the tracking enabled for, let's say, COVID vaccines specifically, as quickly as possible, for as many facilities as possible. But then once that stabilizes and you have a good routine and process, then you can start to expand either into additional features within the COVID area, or even start to talk about adding other programs into OpenLMIS, so that you could be tracking things like your essential medicines, or maybe like a TB program, things like that. Next slide, please. So excuse me. So this is a slide just to kind of hone in on that idea of starting simply and growing organically as your specific implementation requires. So the simple solution that we would start with would be keeping track of the allocations, specifically being able to at least monitor and be able to go through some kind of approval process for emergency allocations, like if a key facility is running out of vaccine. Being able to push out vaccines, meaning that you would probably have some kind of central warehouse or maybe district warehouse that would be the decision maker in terms of what facilities are getting what levels of vaccines. And then some specific dashboards that were built tailored to being able to track this COVID vaccine related information. Then over time, you can add things like lot and expiry tracking, cold chain equipment, and integrations into other systems, where eventually then on this right-hand side, OpenLMIS can be able to be demand-driven. You can be able to have a more robust order and approval process that's integrated into OpenLMIS, more products that are included in more programs, more indicators. So being able to track more information within the reports that you can create and tailor towards your specific needs. And then more advanced auto calculation resupply, quantity calculation mechanisms, so that you're getting assistance from the system to kind of guide you in what are likely the best distribution models that you could use. Next slide, please. So this COVID edition is something that we have available for people to be able to use, whenever. We're available right now for that to be able to to roll out. It includes, like I said before, stock management, reporting and requisitioning, cold chain equipment, and then offline support that I mentioned before. We have some specific dashboards, and we've already gathered a bunch of global metadata. So the metadata would be things like products and information about how those individual products link together with links to the GS1 codes and things that are recognized more globally. And this is a free launch package. So this is something that, because we recognize it's very important and we want to try to be able to help countries be able to track their vaccine rollouts, this is something that we're offering for free for 6 months. That free package is specific to this limited COVID configuration, and it includes a cloud setups and then also training from Village Reach, Chai, and Sol de Velo over a period of 6 months. So this is something that we're hoping to be able to get out to as many places as are interested in using it, and do so quickly. Quickly is probably in the order of 1 to 2 months, depending on how quickly we can get the data that we need and the buy-in that we need from the country, which is something that Brian will go into in a couple minutes. And then lastly, the last point there is just some of the things that we can start to move into over time, which would be the mobile app that we're working on right now, and then starting to discuss with countries about specific customizations that they might want. We know that the data location tends to be something that comes up over time. That's something that we start off hosting in the cloud just because it's significantly easier and more cost effective to do so. But if there's interest in being able to deploy in country, that's something that we can certainly help support, though not initially. Next slide, please. So this is just a slide to give an idea of, when I've been talking about data visualizations and being able to look at the information that comes out of the system, what kind of data can you look at? And we'll look at another example on the next slide as well. We use another open source system called Superset to be able to monitor, to be able to report on the data that we have in OpenLMIS. And Superset is really flexible, and it allows for almost any user to be able to kind of slice and dice the data that they want and get like a live response, so that they can really kind of investigate data. The images that you see there on the right are just some of the examples of the kind of charts that you can build. So you have the normal line charts, bar charts, different kind of graphs, but you can also do things integrating data into maps. You could do, most people don't really actually need this, but you can do all sorts of like 3D animated things, which are kind of cool, but perhaps not worth the effort. In any case, I think we lost our, oh, there we go, thanks. In any case, yes, so the reports that we include with OpenLMIS out of the box are reports related to stockouts, stock status at individual facilities or districts, regions, things like that, consumption, orders, and then reporting rates and timeliness, which is only really appropriate if you have facilities that are making requests for requisitions for commodities. And then there's all sorts of filters that you can do. But the important thing to note here is that this system, Superset, allows you to be able to take those built-in reports and customize them to meet your specific program KPIs, and be able to hone in on exactly the data that you need to see. For an example of that, if you go to the next slide, we have this is a mock-up of a report dashboard we're working on for COVID-specific information. And so we can see here at the top, we would have these filters, which would allow you to say, I want to look at just a specific province or specific district within a province, or any of those other filter things there. And then the data down below would get updated based on what you changed in the filter, and that would happen live. So the idea here is that we would have one dashboard that allows us to see at a glance the stock on hand information or stock availability information, starting out at a high level, but then letting you dig in to get to a lower level to, if you notice that, for example, District 1 seems to be low in terms of their stock on hand in week 12. Okay, so why is that? And then you can start to dig into that more. But the idea here is you want information at a glance. So you can look at it, be able to see the key vaccine data or KPIs that you care about, and then be able to dig in more to find out or start to investigate what may be the causes of those aberrant data. Next slide, please. So OpenLMIS right now is in use primarily, as you can see, in sub-Saharan Africa. That just tends to be where our impact has been thus far. We are easily translatable. So OpenLMIS right now has 4 different translations: French, English, Portuguese, and Spanish. That's mostly just been driven by the countries that are using it. But OpenLMIS is actually extremely easy to create translations for. So if you have a different language than one of the ones that is listed here that you would want to use OpenLMIS for, as long as we can have a little bit of lead time to be able to create those translations, the technical process to do so is very easy, and the system just immediately adapts. So it's easily localizable. It's used in many different contexts, even within the sub-Saharan area that it's used right now. We can see for over right now just 11,000 health facilities, more than that. And then the next slide, we'll talk a little bit about deployment. That's often a question that comes up. The COVID edition, as I said before, is something that we are hosting in the cloud. So, something like AWS would be what we would be using. But in terms of like how the deployment works, I won't get too technical here, but the system is set up to be very easily software, or excuse me, any kind of hardware stack from, like, I can have it up and running on my laptop fairly easily. I can have it running in an in-country data center using the same process, or I can have it up and running in Amazon Web Services, all using the same process. Very easy to monitor and to update. So the question is just about, where does it make sense? What level of hardware capabilities do you need based on the number of concurrent users that you're going to have? But OpenLMIS has been designed from the beginning to be easy to set up and run, easy to deploy. And with this COVID edition, it's also very easy to get up and running in terms of the setup, because it's pre-configured and ready for you to go. And with that, let me hand it over to Brian.
Thanks so much, Wes. And you're able to hear me okay?
Yes, you sound great.
Okay, great. And just tapping back into something that Wes had mentioned before around sort of the integrations into the overall ecosystem. When one of the key aspects around OpenLMIS is breaking down those barriers between the data exchange as well as the supply chain silos that might have previously existed in the country. And so there is integrations that with DHIS2, the District Health Information System that's used as the national HMIS in Malawi, in Mozambique, and then also coming online in Angola, which basically maps the stock on hand information and be able to provide that into the same data elements into the DHIS2 system, basically largely allowing for triangulation of information as well as reducing the overall sort of complexity of dual data entry. And then there's also sort of integrations with the national warehouse management systems. One of the aspects around having sort of seen that map of all of the different national implementations from OpenLMIS, the challenge largely has been less around the setup of the system. As Wes mentioned, you can get it going on a laptop, or in the COVID edition, we can just snap on a new instance for a country within a few days. The larger challenge often has been the master data management inside of a country, as well as the process and requirements, and what is the major challenge that the country is looking to undertake. And in general, OpenLMIS can digitize an inefficient and effective system, but it's only just going to make that faster, and the project's not going to likely to succeed. So having that why of what the country is really looking to achieve, or that particular health area, that is sort of a key driving factor for any type of movement from paper to digital. And then from that, that goes into the next level of detail on the requirements and for the particular country context. As Wes had in an earlier slide on the COVID edition, we like to start off with that particular challenge of that, and then grow over time. And so not just the newest, most exciting advanced piece of traceability, but detailing out this initial piece, and then going through continuous process improvement, and then turning on additional features and capabilities for the users over time. And also the sort of the final aspect for me on the critical success factors is that what is the end game for continuous process improvement? And so understanding that we shouldn't just be using OpenLMIS isn't a magic system, nor is mSupply, nor is Logistimo or others that might be out there. It does require that buy-in and ongoing support and maintenance, users needing refresh training, looking at those reports that Wes showed and seeing what needs to be focused on. And so that you're applying adaptive management principles around supply chain, around cold chain management, around logistics and transportation, so that you're basically being able to hit the standard operating procedures and the levels of KPIs that the country is looking for. The other aspect that we sort of look for as far as a success factor is there are sort of standard operating procedures of how the system should be configured. This may be the time to sort of review and refresh them, but the configurability of OpenLMIS really allows for those to be automated within the system. And so an individual doesn't need to use the calculator offline to figure out what the ideal stock amounts are. Those can be all sort of calculated based upon the information that's available. And so then the system itself can fit into the overall e-health architecture of the country, connecting into the DHIS2, connecting into the electronic medical records systems, being able to live on a information exchange that connects with the human resource systems, et cetera. All those integrations are sort of have the OpenLMIS can fit into that piece. And that's why we've also been strong players in the OpenHIE community and those particular workflows. One of the other aspects around that technical support is who is the technical working group on digital health or logistics in the country. Actually having those often sort of live in two different areas of the country, and so the governance may often be a challenge. And so having a clear consensus on those processes and tools from those national stakeholders and program managers at all levels of the official system really helps move things forward. While OpenLMIS can live offline, it does need some level of connectivity, and so having at least that 3G and a reliable power source at the facilities to be able to provide that information back and be able to share and pull down information is a key piece. And then we also often recommend what are those devices and tablets and computers at the implementation sites. And so you aren't having to transport paper from one spot to another and have a district or county having to rekey in all that information on the facility. That often sort of slows down if you're expecting the automated logistics to happen at a hospital or a level 5 facility. And then finally, just as I mentioned before, of having that technical support, at least for tier 1, that's easily accessible for the users. We do have a whole OpenLMIS readiness sort of guide, a getting started guide available, and happy to sort of go through those details with you as well. And I'm going to click my next slide. There we go. OpenLMIS itself is also, as Wes mentioned, is open and extensible, that we have a full open source license from OSI, and then also have a lot of different supply chain standards. This is just sort of a link for your review down the road of looking at our documentation, as well as getting involved in the community. And the architecture, as well as documents and links, are going to be available for you on how we sort of fit in those new features that a country may be looking for that can go into our microservices architecture. Overall, though, we found that the OpenLMIS has met, as you have more and more implementations, the patterns that we see across different countries are often repeatable. And so we may just be adding a more configuration into the system, and really there's not much customization that we've been seeing over the years. As you may have been seeing some of the news around about ransomware and other pieces that are happening. OpenLMIS itself has both a security and audits sort of built into the system. We look at every entry as far as what the individual has access to. And so a health facility may only be able to do the stock reporting as well as the request for a subset of information. So HIV may be separated from immunization, and the district may be separated from the province. And so all those different roles are configurable in the system. And then you can also go back and see what those individuals who logged into the system, what has been entered, so that you have a flow of information throughout the system. And then finally, I've touched on the level 1 and level 2 support that's often managed in the country, but there is more. We do have a whole enterprise support aspect of OpenLMIS. And so there is this tier 3 capabilities that we were able to provide. And that is sort of, as you're continuing to evolve and do continuous process improvement, who are those experts to be able to provide you more information around the supply chain excellence within your particular country. And so also that the enterprise support allows you to, similar to your voting on the Q&A, be able to do thumbs up and be able to increase the priority of future product releases and influence the overall roadmap. We also have it's probably not so much a key user group, but more of a community forum that sort of provides that information and being able to have that early access to the demonstration and releases for that overall mix. Wesser mentioned earlier around the cloud implementation. We do have AWS hosting at around $300 per month. It sort of, again, depends upon the overall data use, but that is most likely the case. When we've moved in-country, the in-country hosting has often been 10 times that. And so we've felt this is a pretty good value for money for the initial start of the COVID edition for different instances, but then can also migrate into an in-country data center over time. And then the overall enterprise support of the items that you're seeing in the check boxes above is $25,000 is what we're looking at for that piece. But that is dependent upon the overall scale and the service levels that we want to set up with the country. And then finally, I've been involved in sort of OpenLMIS since before it became that, back in 2008 out of the Health Metrics Network, and really did see that challenge of the supply chain silos. And so really appreciated all of the contributors over this past decade to this particular work of how do we do a better job of breaking down the data silos that is preventing us from having the right information at the facility to prevent stockouts. And we are seeing that overall impact from here, the provincial medical chief in Mozambique, as well as the EPI manager. And the automation that this provides, once you have the data management and information in place, sort of just is exponential, and really looking forward to how we're able to provide that for a lot of the health supply chain challenges that you're seeing. And so there, at the end user level, we really are looking at how do we make their lives easier, that they are able to do their allocations and their stock management quickly, and that the information and then their ability to be able to do that quickly and easily then provides that overall upstream performance measures on the stock management, the how we're doing better job on cold chain equipment management, and as well as the overall big picture on the support for GAVI, Global Fund, UNICEF, USAID, and others that are providing supplies at that level. I'm really looking forward to this conversation with you, and with that, I'll turn it over for our Q&A.
Thank you very much, Wes and Brian, for this very informative presentation. So now we're going to have a Q&A session, and I'll ask Ben to moderate it. Over to you, Ben. Thanks.
Thanks, Wojciech. Thanks, Brian and Wes. That was fantastic. I know I've learned so much in the last 30, 40 minutes. We've got a huge number of questions coming in from the audience, so I'll try and cluster a couple and work through from top to bottom. Keep them coming, folks, and please upvote if you haven't had a chance. But kicking off with the first one, it's coming in from Janina in the Philippines, who's asking more about the integration side of things. So is there a use case from an existing deployment where OpenLMIS has been integrated with a bespoke data system for vaccine administration? So essentially, have you got deployments already where perhaps government has an existing vaccine administration system, and then you've had to integrate or find a way for OpenLMIS to talk to those existing systems? And before you answer, I just want to bring in a second question from Srihari, which I think is related. And Srihari asks, what's the process for that integration with existing health management information systems? So perhaps if you can talk to both of those use cases for integrating with something like DHIS2 at the top level and other administrative vaccine systems. Over to you, folks.
Wes, do you want me to take the vaccine integration piece, and then you'll take the DHIS2?
Yep, sounds good.
Okay, great. So we do have within inside of Tanzania, there is a vaccine information management system that they have at the facility level. At that side of things, they will manage the stock on hand with inside of that vaccine system, as well as take receipt of the vaccines. And so they basically have automated that batch intake, which vaccines are arriving in what numbers. And so that automates the process into what's called an electronic immunization registry there in Tanzania. And so that does, we aren't providing while OpenLMIS could very well live on that same tablet that they're using at the facility, they've limited what the health workers are implementing at that location. And so basically it's automated into the registry itself. And then all of that information then flows into OpenLMIS and be able to sort of provide that pull of vaccines through the system. Hopefully that answers that particular piece, but it is, we do that, the application programming interface and the standards that we use make that easier for the integrations with other systems. Over to you, Wes, to describe how we do that on DHIS2.
Yeah, for DHIS2 is a little bit, I'll say a little bit more immature, honestly. So we do have running instances of, or excuse me, running integrations of OpenLMIS communicating with DHIS2, but the ways that that information is transmitted is different between those. What OpenLMIS can produce, and some of you may be familiar with the measure and measure report, basically these big extracts from OpenLMIS showing, here's the usage of these specific commodities on some specific interval. And so the data itself is not very complicated. It's just making sure that we can communicate with DHIS2 in a reliable and understood way between the two systems. Our preferred approach is to go through some kind of intermediary that, like I said before, will kind of tie together the various systems within the eHealth architecture. But that's not the only approach that we have. In Malawi, we use a different bespoke system. In Mozambique, it does flow through more of an intermediary. Those are the two implementations that I know the best off the top of my head. But our preference, like I said, is to be able to leverage HL7 FHIR, which is a well-known standard for being able to communicate health-related information and be able to transmit that data using that standard to DHIS2. It's just making sure that you have the various systems in place to support that. If you don't, then OpenLMIS, we can create those extracts, and then they can be, at the very least, they can be manually imported in DHIS2, although obviously that's not a preferred solution.
Thanks both. Now, not unsurprisingly, the next question at the top of our list is, I think everyone's ears pricked up when they saw the word free. I'm going to try and cluster a couple of these questions together on total cost of ownership and what the free model means. But we'll start off with the one at the top of the screen there. You've mentioned a free package for 3 to 6 months, specifically for a COVID use case deployment. Does the country need to pay something after the conclusion of that period? And who provides maintenance and support during the free package? Back to Brian.
And well, and Wes, you can provide more details on this too, because you've been overseeing a lot of the COVID pieces. And so the free aspects of it for us has largely been around the hosting, and so supporting the cloud instance of the COVID edition. And so largely after that 6-month period of the countries picking up that particular payment for the COVID edition, the maintenance aspects of that will continue to be maintaining the core of OpenLMIS in that mix. The enterprise support that I described is largely around the sort of ongoing tier 3 pieces for the country to get that enhanced piece of it. And so if countries want to sort of lean into sort of ongoing use of OpenLMIS after that period of time, and that's where we can start to look at what is your expected use case for implementation, how many programs you're covering, et cetera.
Yeah, I think you covered that, Brian. If there's anything else you want me to add to that, I'm happy to, but.
Okay. Great. I think we'll continue in this theme, because the next question is coming from Sean Blaschke over in coming to us from Nairobi Regional Office, and he asks,
Yay.
Do you have any tools or guidance on estimating the total cost of ownership? And he also says there's often a misunderstanding of what free and open source means in terms of actual real world costs, and as well as a lack of understanding sometimes in planning and post-deployment costs, including support and maintenance. Ryan, I love that you brought up adaptive management and some of these other environmental factors that are critical. And Sean's just given us a quick follow-up. Can you provide a few examples or a range of what an open LMIS instant cost over a 5-year time period? And I just want to loop this back to another question that I saw come in. It was basically saying the same thing. Like, can you give a couple of real world examples from the 8 deployments, I think it is, that they're already there? You know, what's the recurrent cost per annum? You know, could you give a couple of variants, like a country with 10 million people or a country with 200 million, and some of the kind of key critical factors that might influence that total cost of ownership? Back to you.
Okay. Really great question, and and on the overall aspect of it, the cost of OpenLMIS as far as the actual software, it is an open source product, and so that is free. It is, in general, it's more along the lines of what the country wants to invest in its sort of continuous process improvement around logistics systems. And so you can pay for an overall implementation of putting together what are all the tablets that you need to put in place, what's the training system that's there to be able to do that continuous process improvement, what are the changes in the standard operating procedures, how many programs you're going to have involved in that overall mix, are you going to host it locally in the country data center? And so all of those sort of the software itself is a rounding error in the overall costs of what a country might want to put in to improve its overall supply chain management system. And so, for example, some of the aspects that you want to put in on a total cost of ownership is probably sort of more based on a per facility and the size of programs that are being involved, of how many devices do you have in that particular location, what is the cost of the communication plans and the maintenance for the reimbursement, and so what is that overall cycle? Are you replacing the tablets or the laptops every 3 years or so? Then there may be aspects around the refresher training or individuals that turnover that you might have in the country on individuals that are doing the supply chain, and how do you bring those individuals in? Are you able to implement in country a virtual training model, or do you need to bring them all together, and that associated sort of in classroom training environment often sort of is an amplifier of the overall total cost of ownership. And then finally, as I mentioned earlier, around the data center hosting costs, that can be hundreds of thousands of dollars in a particular country to have those skilled individuals managing the security and the patches and other pieces beyond just what OpenLMIS is. And so we have some aspects of it, but it's probably easier for us to model with a particular country because there are a lot of if-then statements to be able to cover that.
Great stuff. I think we've hit most of those clustered questions. So I think we can move on to the next one, which is coming from Paritosh. Can we capture the human resource details? And maybe just to flesh that out a little bit, I think I've seen reference to a number of integrations with some common health human resource information systems. Could you give us a little bit more details and on where kind of HR integrations might happen, particularly if you've got a large workforce of frontline health workers, for example? Back to you.
Yeah, great call out. And Wes, I'll pass this over to you largely because I don't believe we've got any integrations with Iris or others as of yet. I think it's all largely just the user access and with inside of OpenLMIS.
That's right. Yeah. So, and thank you, Brian, for bringing the one you don't know over to me. Yeah. So HR systems, we don't have any current integrations with them. Most of the user management within OpenLMIS is very specific to OpenLMIS. So I think the only thing that would be appropriate to bring over in terms of an integration would be some kind of single sign-on system, or maybe just information about users and facilities, maybe like locations. That would actually probably be pretty helpful. In any case, OpenLMIS does have the constructs in place to be able to support that kind of integration. So whether it comes from like a single sign-on, which we can do through our authentication system that we utilize called OAuth 2, or being able to automatically populate users and at least initially populate their configuration, their roles within the system. That could be handled. We just haven't had an example where a country implementer has been interested in doing that at this point. To be honest, I don't know very many countries that are actually using those kind of more holistic HR systems, at least not within the health specific realm. So that would actually be a very interesting integration to try to work through.
Thanks, Wes. We've got a couple of questions now that are kind of leading more into the functional side of things. Srihari, thanks so much for so many of the questions coming in from you and Rosa. You've just asked, can OpenLMIS capture inventory beyond just CCE and essential medical equipment inventories? Back to you, Brian.
And Wes, I'll let you describe sort of the asset management pieces. And it is, I mean, just yes, it is all stock. And then we have assets as a sort of another functionality within inside of OpenLMIS to sort of what beyond sort of what the refrigerators or the vaccine carriers. So Wes.
Yeah. So like Brian said, yes, we can technically do that. You can include any arbitrary pieces of equipment that you want. However, I do think it's important to note that oftentimes the root of this question is actually being able to do asset tracking, being able to track maintenance requests, be able to see lifetimes of product, the much more detailed lifetime product information about pieces of equipment. And OpenLMIS is not an asset management system, so it can do basic equipment tracking to kind of let you know. Here is, that this piece of equipment is at this place. You can be able to record a log of information about the operational status of that piece of equipment. But when you want to really dig into being able to track, your whole perspective of where your equipment is, what the status of it is, who's, what vendor is tasked with being able to maintain that product, what are the contracts related to that, and it gets pretty deep pretty quick. And so we've talked about that at OpenLMIS a few times. The feeling that we've come back to is that it's far enough away from logistics management that it actually makes more sense to think about integrating OpenLMIS with a system that does that, rather than trying to build all of this asset management functionality within OpenLMIS. I can tell you that we have basic tracking for equipment, any kind of equipment that you want. But if you want real asset management, you should start to look at asset management systems, and we'd be happy to help make some suggestions about that. But But that is not what OpenLMIS is likely ever able to or ever going to be doing.
Thanks both, and I think it's a great segue to another fantastic question here from Sean. I was hoping to see this one upvoted. One of the challenges we've seen with OpenLMIS, or indeed many systems, is that some countries and partners push for implementations that are very heavy and complex, particularly when maybe they're starting from scratch or from a paper-based system, which then leads to lower adoption and overall usage rates, or worse still, people kind of pointing the finger at the technology and saying it's failed. In your experience, what is the right level of complexity for OpenLMIS implementation? And how do you manage, communicate this to country stakeholders? Back to you.
Wes, do you want to do that one or do you want me?
I can go. So it is an absolutely great question, because that is definitely one of the main issues that comes up, and it's, you know, it can lead to lower adoption. I totally agree, but I think the more prevalent issue is that it leads to much longer rollout times and much more expensive. Being able to take OpenLMIS as it is and just say it's configurable enough, it'll work for us, even if there's some edge cases or maybe areas where there's some, you know, some specific areas where it doesn't meet our specific requirements, or at least what we think our specific requirements are. But you add like an order of magnitude more cost, or, you know, it takes much longer to implement. So in general, my advice here is go as simple as possible. Look at what OpenLMIS does, and like what OpenLMIS does is not arbitrary. It's based on what countries have needed for the last 15 years, the various versions of systems that have predicated it. And so it works in a wide variety of very common settings in the logistics space. And so if you can take that, kind of like what we've done for this COVID edition, and be able to just take this and say, we are just going to use this right now. And then, we'll have a phase 2, we'll have a version 2, we'll have, another rollout where after we've evaluated how this fits into our structures and what the rough points are, then we can decide to make changes. That's a much more effective approach to get up and running really quickly, and much more cost effectively, and be able to actually find out what are the things that you really need the system to do versus what are the things that, one specific stakeholder thinks is this vital feature. But really, if you dig into it, it's just this one specific stakeholder that wants this feature, and it may not actually be that important, but it's going to add, $20, $30, $100,000 to the overall cost because of the complexity of developing that feature or doing additional training, or whatever that specific individual functionality may require. So yeah, in short, I would say try to keep it as simple as possible in terms of the rollout. Stick to what OpenLMIS does well. And then try to branch off from there, rather than trying to say from the get-go, the system needs to do, this 200 page RFP worth of features.
Maybe just one thing to add on to that. Look at the paper forms that you're using today, and see if those can be simplified. Can you automate a lot of that calculations inside of the system itself? We shouldn't be using routine data collection as a research project. And so how do you make the lives of that data entry from the front time end users as tight as possible? Because I have a strong opinion that the more data you ask to collect, the lower the timeliness and the lower the accuracy. And so if you can tighten that down into just what is needed to be able to do supply chain and doing as much automated calculations and automated data capture as possible, that will help.
Thanks, folks. I feel like that question might go on for hours if we let it. And maybe that's a nice segue. I think it's probably time we wrapped it up. I can see lots and lots of questions still there. So folks, thanks so much. We will endeavor to work through those with Brian and Wes and colleagues in the coming days. And we'll post those up to all attendees and get them up on the internal UNICEF SharePoint and available for externals as well, alongside all of the recordings from today. So don't fret, we'll get to those Q&A as soon as we can. But I wanted to say the other kind of logical next step. Hopefully many of you have heard something today and you're interested in following up with OpenLMIS. If you're with UNICEF, please take the opportunity to reach out to your regional immunization and T4D focal points, and they can help facilitate a deep dive or a call with the OpenLMIS team to explore what might be possible. So would really encourage you to do that. In addition, if you're coming to us externally, today's event is co-hosted with the Digital Health Center of Excellence, and I'll put a contact email in the chat shortly, where you can find out more about the center and how it functions, and where you might be able to call in support there as well, alongside a link with a bit more information. So thank you so much for the Q&A. I'm gonna hand back to Wojciech for a few quick closing remarks. Over to you, Wojciech.
Thanks very much, Ben, and for moderating the Q&A session, and thanks very much, Wes and Brian, for not only giving us a very informative presentation, but also answering the questions. I think the fact that we had something like 23 questions that sort of came up from colleagues, indicates a large level of interest. And personally, what I found interesting in your presentation about your system is that, as you said, it's scalable from a different levels of implementation, from being able to be deployed on a laptop all the way to a data center or software as service, that it also supports the standards, sort of, and you mentioned interoperability standards or FIRE, as well as the fact that you also specifically put the features to provide support for the COVID in your COVID edition, to support COVID vaccination rollouts. So I think we found it very interesting. So thank you once again. Thank you to all the attendees for your interest, not only attending, but also for raising the questions. As Ben has mentioned, we will post the recording from this webinar as well as the presentation, sort of, and share those links with you. And at the same time, sort of, we will also perhaps look at answering some of the unanswered questions, that you have shared with us, and also share the answer to those as well. So thank you very much once again. I also, sort of flagged that this was the second webinar in the series, and sort of there will be more webinars coming, sort of in the same space. So please look out for the further advice about forthcoming webinars. But in the meantime, once again, thank you very much for attending today, and have a great day. Thank you.
Thank you all. Bye.
Great, thank you so much. And I just wanted to have just a final remark here that also wanted to thank Vital Alliance for joining the OpenLMIS community as the global steward for the software. And they've provided us a lot greater levels of activities and country reach, and really appreciate their support over these coming months as we sort of accelerate more of the capabilities and impact of OpenLMIS. Thank you all.